For the best medical and paramedical lectures, subscribe to our channel and press the bell icon to stay connected with us. Hello everyone, welcome back to the NCLEX RED preparation part 15. Today we will start with the 71st question. So let's begin. And here it is. The question says that the client with the preeclampsia is admitted to the unit with an order for magnesium sulfate. Which action by the nurse indicates the understanding of magnesium toxicity? Which action should nurse take to understand the toxicity of magnesium is present or not? So the options are: the nurse performs a vaginal exam for every 30 minutes. The nurse places a padded tongue blade at the bedside. The nurse inserts a Foley's catheter, or the nurse darkens the room. Which action of the nurse should be present to understand the toxicity of the magnesium sulfate? So the correct answer will be the nurse insert a Foley's catheter, because the client receiving the magnesium sulfate should have a Foley's catheter in place, and hourly intake and output chart should be mentioned and checked properly. Answer A, B, D are incorrect because they do not indicate the understanding of MgSO4 toxicity. In the receiving an order by the MgSO4 magnesium sulfate, the input and output chart is necessary and should be checked hourly. So our answer C, the nurse insert a Foley's catheter, this action is correct. Moving on further, 72. The best size cathlon for administration of a blood transfusion to a 6-year-old is 18 gauge, 19 gauge, 22 gauge, or 20 gauge. Which size of catheter is used for the administration of a blood transfusion to the 6-year-old? So basically we will use the medium size. It is 20 gauge, because the 20 gauge is a correct answer because it is the best size cathlon to use in a child receiving a blood. And ABC, which are 18, 19 and 22 are incorrect because they are too small or too large. We should have to select the correct size according to the age of the patient. And here at a 6-year-old we will select the 20 gauge. Moving on further, question number 73. A client is admitted to the unit 2 hours after an explosion causes a burns to the face. The nurse would be most concerned with the client developing which of the following problems? So the problems are hypovolemia, laryngeal edema, hypernatremia, or hyperkalemia. Which should be the priority concern for the nurse in this kind of condition? So the answer will be laryngeal edema, because the nurse should be most concerned with the laryngeal edema because of the area of the burn. The client is burned, exposed on the face, and it is bring to the hospital after the 2 hours. So the laryngeal edema will be the most topic or most concerned thing the nurse should do. The next priority should be answer A, as well as hypernatremia and hyperkalemia. These answers are not for the priority option, they are secondary. We should check for the laryngeal edema prior. So answer B is correct and answer A, C, D are incorrect. Moving on for the 74. The client has recently been diagnosed with the diabetes. Which of the following indicates the understanding of the management of diabetes? So which are they? Let's see. The client select a balanced diet from the menu. The client can tell the nurse the normal blood sugar level. The client asks for the brochures of the subjects of diabetes, or the client demonstrates correct insulin injection technique. So which of the following indicates the understanding of the diabetes management to the client diagnosed with the diabetes recently? So the correct answer will be the client demonstrates the correct insulin injection technique, because it is the most important thing that a diabetes patient should do. The client with the diabetes indicates the understanding of his illness by correctly demonstrating the technique for administration. Answer A, B, C are incorrect because they do not indicate the understanding. Question number 75. The client is admitted following cast application for a fracture ulna. Which findings should be reported to the doctor? So, pain at the site, warm fingers, pulse rapid, or the paresthesia of the finger. Which findings should be reported to the doctor if the client is admitted for the following cast application for the fractured ulna? So the most concerned thing that we should tell the doctor, that is paresthesia of the finger, because at this time pain beneath the cast is normal because it's a fracture case. The client finger should be warm to the touch because it should have the blood circulation, and the pulse should be present because of the connectivity of the arteries and vein. Paresthesia is not normal and might indicate the compartment syndrome. Therefore, answer A, B, C and incorrect, and D, that paresthesia of the finger. This complaint should be talked with the doctor immediately. So thank you everybody. I hope you all have understand it. We will see you soon with the next part of this NCLEX preparation. Till then, stay home, stay safe and take care. Do like, leave a comment and share with your friends.